It's something about that music that just gets me emotional. Is it just me? It's that and it's Here Comes the Bride. I don't know what it is about those two things, but it just gets me emotional. Yes, Marlon sent me a private message. It gives you the chills. Absolutely. Hello, everyone. Happy Saturday. Congratulations, graduates. Thank you all for joining us. My name is Quisha Umemba. I am so excited today. I'm probably more excited than you all are. You are my fourth cohort and second graduating class of CHWs and CHW instructors. And I don't want to take much of your time today, but I want to recognize you. And I hope that you accept, this little time together really as appreciation for you coming to Umemba Health and Umemba Health Academy and really entrusting in us to help develop you to take you to the next level. So let's get started with the presentation. I'm going to pull up my slides here. And I tell you what, I will do this. I'll start showing a video. For those of you that are not familiar with what a CHW is or does, let me show this video. And I apologize for those of you that have seen this video before. I know a lot of you have. But let's go ahead and just level set exactly what a community health worker is and does. Do you all see my screen that shows community health workers? All right, let's hear a word from our governor.
Hi, I'm Dr. John Hellerstedt, Commissioner of the Texas Department of State Health Services. Community health workers, or promotores de salud, are essential in achieving our vision of a healthy Texas. In the last 50 years, this grassroots community profession has turned into an emerging workforce. Texas now has over 4,000 certified community health workers in 144 counties statewide. Community health workers are non-medical frontline public health workers who improve community health. Community health workers are trusted members of their communities. They share the same language, ethnicity, culture, education, and backgrounds. The roles of community health workers are diverse, but essential in improving the health of Texans. Community health workers work with healthcare teams to bridge communities with health and social services. Community health workers also help communities by advocating for their needs, connecting them to resources, and providing health education. City and county local health departments, clinics, and hospital systems, and nonprofits all employ community health workers. It is for their skills in community outreach and chronic disease self-management education, as well as patient coordination and navigation. Community health workers are nationally acknowledged for their cultural competency, passion, and ability to improve health outcomes in their communities. The Department of State Health Services thanks and recognizes this exceptional workforce as an essential asset to Texas health. DSHS is educating employers regarding the value of community health workers and the cost-effectiveness in improving the quality of care for Texans. I invite you to consider joining the community health workers workforce in Texas. Texas will be healthier for it. Thank you.
Thank you so much for allowing me to play that video for you. I think it's important for us to level set, especially for individuals that are here that don't know exactly what community health workers do or the important role that they play in the community. So thank you so much for watching that. Let me get back to my presentation now so that we can celebrate our graduates. Do you see my community health worker virtual graduation slide? Perfect. I want to make sure that I'm on the right one. So again, my name is Quisha Umemba. I am the CEO of Umemba Health LLC, which is a public health consulting and consulting agency. We also have an educational arm, and that is Umemba Health Academy. And today you're here to help us recognize and celebrate our 2022, and some of them from fall 2021 graduating graduates. So those are community health workers and community health worker instructors as well. A little bit about Umemba Health Academy. Umemba Health Academy is a virtual campus for CHWs, for CHW instructors, and other frontline public health professionals. And our mission at Umemba Health Academy is to elevate what I consider to already be a multi-dimensional skill set. And we do that through competency-based instruction. So at Umemba Health, we believe a few things. We believe that health workers have incredible expertise and that we can activate that even more and even better through online learning and through virtual training. We believe that frontline health workers really are the heart and the soul when it comes to healthcare and public health. And we believe investing in frontline health workers is a win-win for everyone that produces positive results for the worker themselves, for employers, and also for the communities, the individuals and the communities that they serve. Now, our governor just told you a definition of community health workers and some of the things that they do. And a lot of times that is so abstract to people. One of the things that I do is I try to put that in layman's term, or I try to provide an example that makes it more applicable. And so one of the examples that I give people when I talk about community health workers is I say, your doctor tells you that you need to go on a diet, right? Your nurse tells you the foods that you need to avoid. But the community health worker talks to you about making healthy lifestyle choices. They refer you to the appropriate resources in the community. Maybe there's a community nutrition or cooking class. They refer you to that. If you meet certain requirements, they help you to get food stamps or SNAP benefits. If you would like to shop at the farmers market, they tell you where those farmers markets are in the community, and on and on and on. And so they really are what I like to refer to as the real front line. They're the boots on the ground that's really making sure that they're removing those barriers to access and barriers to getting good care and optimal health outcomes in our communities. Again, my name is Quisha Umemba. I am the training director of Umemba Health Academy. It has been my pleasure, my absolute pleasure, to also be the instructor for our CHW instructor students. Many of those I'm going to be recognizing here in just a little bit. But at this time, I'd like to turn it over to Marlon Ramirez, who was the instructor for our CHW students this semester. And I will let Marlon introduce the CHWs and CHW candidates that we're recognizing this semester.
Good morning, everyone. Thank you, Quisha. Super excited to have everybody here today. As Quisha mentioned, we are super excited for all our graduates. Thank you so much for allowing us to work with you. I do want to mention that some of our students actually completed their courses last year and have applied with the state and are officially certified as community health workers, which is the final step to be fully recognized. These students you see listed on the screen participated in our live or online CHW courses in the summer, fall of 2021 and spring semester of 2022. These students come from all walks of life. Some of them are new to the field, and some of them have been doing this work for years. Some of our students are transitioning from other areas or adding the CHW certification because they see the value in being what I call a social determinant of health expert. Today, some of those students are joining us virtually, and we would like to recognize them. We will start with Alicia Carter. Congratulations, Alicia. Looking forward. Elizabeth Chavez Bonilla. Congratulations, Elizabeth. Looking forward to seeing you as a community health worker. Jessica Gutierrez. Congratulations, Jessica. Super excited for what the CHW course has for you. LaQuinta Harris. LaQuinta, thank you for everything you do. Sanjita Kurata. Congratulations. Excited for what the CHW field has for you. Nathan Pollen. Congratulations, Nathan. You came a long way. Jessica Ramirez. Great job, Jessica. Leticia Scout. Leticia was also our Student of the Month. Congratulations, Leticia. Karina Salvador Davis, who is also one of our Students of the Month. Great job, Karina. Great having you in the class. Catherine Schneep. Congratulations, Catherine. Best of luck to you.
I'll take it over from here. Thank you so much, Marlon. Before I introduce and recognize our CHW instructor students, I want to say also some of these students have already completed their courses, some in summer or fall of 2021. Some are not from Texas. I know that we're located in Texas. A majority of our students are. In fact, Karina is actually from Kansas City, Missouri. But also I just want to say that, these students are joining what I refer to as really an elite group of individuals. I don't know if you heard the video or not, and the numbers are slightly off, but as Governor Hellerstedt said, upwards to 4,000 community health workers are certified in the state of Texas. However, there's less than 300 CHW instructors. And so I like to refer to our group as small but mighty. And you individuals are joining this very elite group, being able to pour into others. So some of our individuals that are joining us today, I would like to recognize you at this time. And I will pause a little bit too, in case you want to take pictures of the screen as well. So first things first is Ms. Vivian Adams, Community Health Worker Instructor. Vivian, it was a pleasure having you in the course last semester. Congratulations on your accomplishment. Alan Barrett, CHW instructor. Alan was a phenomenal student. He received Student of the Month, perfect attendance. I don't think he ever missed one class. And Alan, you did not know this, but you were nominated by your classmate, Brenda Garza, as a major contributor. She did this on April the 3rd, and she wrote, Alan deserves the recognition of major contributor because he has encouraged us to be vulnerable as instructors by sharing his personal experience as a recovery coach at the CHW instructor program last Thursday night. Way to go, Alan. Keep inspiring others. Congratulations to you. Congratulations to Norma J. Cruz, CHW instructor, who also received perfect attendance as well as Student of the Month on one or two occasions. I've already gotten word that Norma has recently gotten a promotion where she will be doing teaching at work. So congratulations, Norma. Excited to see everything that you're going to do in the field. Next is Brenda Garza, Community Health Worker Instructor. Brenda actually started the program 3 weeks late and had to dig her heels in to get caught up with everyone, and she did a fantastic, spectacular job. So proud of you, Brenda, and congratulations. Jessica Chester, affectionately known as JR, Community Health Worker Instructor, and the newest instructor to Umemba Health Academy. So looking forward to what you're going to do in the field, and so glad to call you a colleague. Congratulations, JR. Carlene Thomas King, Community Health Worker Instructor. Also never missed a class. She took classes from the car. She took classes from the ER room. She was not about to miss a class. Also one of our Students of the Month. You're going to be an amazing instructor. You have a bottle full of passion, and I can't wait to see you pour into the next generation of community health workers. Dr. Shauna Lee Hall, Community Health Worker Instructor. You were a joy to have. I learned from you as hopefully you learned from me. Congratulations on your accomplishment. Amanda Romero, Community Health Worker Instructor. Thank you for digging in and sticking it out, Amanda. Even when life got tough, you did not give up. Congratulations to you. I also saw something on our Kudo board where someone said that you literally saved their life. And I foresee you doing a lot more of that as a community health worker. Congrats to you. And last but not least, in any way, Miss Bernita Bella Perales. Congratulations, Bernita, for sticking it out. I know you wanted this so bad. I'm so proud of you. You did just that. Congratulations. So one word that I will tell all of you, and I said this to my class on Thursday night, is that you're going to be in a position where you're pouring into other people. And I want you to remember that you have to pour into yourself first, okay? We've all heard that saying, you can't pour from an empty cup. And so I share with everyone that I know to do something every day where you can fill your cup up. And whatever is overflowing, that is what you give to others. You don't give from an empty cup, you give from your overflow. Again, congratulations to our graduating class. At this time, I would like to open it up to anyone that would like to make any remarks. We'll use about 10 to 15. Let's do 10 to 15 because we're doing good on time. 10 to 15 minutes. And the way that I'm going to ask you to do this is to raise your virtual hand if you would like something to say. I see Carlene got her hand up quick. Raise your virtual hand and keep it up. And then as we call on you, we will lower your hand for you. So go ahead, Carlene. The floor is yours.
First of all, I want to say thank you to Quisha, because I think everyone in our class, we kind of came into this nervous, scared, just not knowing if we were going to be able to do all of this. But as we progress through, Quisha, I take my hat off to you because you actually, encouraged us along the way. And then, to each of our classmates, everybody had something that they said during this 15, 16 weeks that actually, helped me and inspired me as well. So thank you all. Congratulations to all the CHWs and to all the CHWIs.
Thank you so much, Carlene. LaQuenta, go ahead. There you go.
Okay. Can you hear me?
Yes, we can hear you.
Okay. I would like to say thank you to you, Quisha, and to Marlon for being a wonderful instructor. And thank you for your program, Quisha. And Marlon, I would like to give you a special thank you for all of your patience with our class, with our busy schedules. And congratulations to everyone.
I second that. Congratulations to everyone. Thank you so much, LaQuenta. I don't see any other hands raised, so I'll do what I do in class. I'll do the pregnant pause. There we go. Alan, there you go. The floor is all yours.
Good morning, everyone, and congratulations. I too want to say thank you to Quisha. I had a lot of fear and doubt, self-doubt coming into this class, and I've told everybody who will listen that it always begins with the teacher, and you're an outstanding teacher, and we were just so lucky to be a part of this class. And I also want to say thank you to all my classmates. I learned so much from all of you. It was just a joyful trip. It was stressful at time. I think I mentioned there was a time when I was at my computer almost in tears about one of the homework assignments, but I got through with everybody's help, and we talked about it and we supported each other. So congrats to all the CHWs and my fellow classmates. It was such a joy. Thank you all so much.
Thank you, Alan. I will second that. Every semester is a joy for me, but yes, it was definitely a joy. Let's see. I think I saw a hand raised. Sangeeta, go ahead. The floor is yours.
Hi, Quisha. It's so good to see you again. It's been a minute. I myself went through a lot of struggles getting to this point, just balancing school and work. I'm currently a master's student, and I was originally set to graduate in summer. And so I just want to personally take the time to thank Quisha. Quisha, you are one of the best mentors I've had so far in my professional career. And honestly, I would not have been able to make it through without you nudging me in the right direction. And I'm really excited to see what every one of you does in the CHW field and beyond.
Thank you so much, Sangeeta. Sometimes I feel like my emails are a little bit annoying, but I'm like, oh, you're almost there. Just 2 more assignments, just 1 more assignment. You're almost there, you can do it. So I'm glad to hear that. Congratulations. I'm so glad you stuck with it and stuck it out. And I'll give a few seconds for anyone else that feels compelled to share. Don't feel pressure. Go ahead, Vivian, you can speak.
Good morning, everyone, and good morning to Quisha as well. I want to say thank you so much for your time and your energy that you put into all of us. And also, I want to say congratulations to all of the CHWs and the CHWSI, and a special shout out to JR. As you said, you mentioned a newest member to your team. Way to go, JR. We were in the same class. I know you had a lot in you when you spoke and everything. So many well wishes to you and everyone else.
Thank you so much, Vivian. Amanda, the floor is yours.
Hi, thank you so much, Quisha. You are absolutely right. I had a lot of ups and downs, but I made it, and it was all because you were inspiring me to continue going. So thank you so much. I had a great time, a great experience with this class. And I'd like to say congratulations to my classmates because I learned something from all of you. So thank you so much. And and congratulations to all of the CHWs.
Thank you so much, Amanda. Karina, go right ahead.
Thank you so much. I just wanted to say congratulations to everyone in this graduating class, but definitely a big thank you to Marlon and Quisha. Without this opportunity, I don't think I would be getting back into getting into school. And so I do appreciate being able to start with this. And I am very excited to see where this does take me. So a big thank you to you both for letting me complete this class on time, and then you guys staying with me, and Marlon giving me a phone call just to make sure that I do keep things together. So a big thank you to you both.
Thank you, Karina. Good to see you. Hi, Mama and Daddy back there.
Hi.
Awesome, awesome. Thank you so much. I really do appreciate it. Marlon appreciates it. It's further confirmation that we're doing exactly what we need to do. And the only thing that we expect in return is the same way that we've impacted your life, that you go out and you impact someone else's life in the same manner. And that would be the best thanks for us. So at this time, I'm super, super excited to introduce to you your commencement speaker. So I could have done this, right? We know I could have did this, but I wanted someone that was really phenomenal, for lack of a better word, somebody that's boots on the ground, that has really a demonstrated passion for community and for community service and for volunteerism. And I have been fortunate to work with Connie a couple times. She's been in one of my CHW mentorship programs. And you know what, let me just stop gushing over her and fangirling and just read her bio, because it is quite the impressive bio. And then after that, the next voice you will hear will be your keynote speaker. So Connie Asif serves as a community health worker instructor in the 3rd largest county in the United States, which is Harris County, Texas. She uses her 14 plus years of working in public health and caring for 2 aging parents to serve as a health services manager for Harris County Commissioner Precinct 2. Connie holds a Bachelor's of Business Administration degree from the University of Houston downtown with a minor in purchasing and materials management. She also holds a Master's of Business Administration from the University of Phoenix. Connie has always taken advantage of trainings and certifications offered to her where she feels it would empower people to achieve their health goals and believes their health span should equal their lifespan, especially in underserved and minority communities. Mrs. Asif is a certified instructor of Tai Chi, diabetes, chronic disease, chronic pain, asthma, fall prevention powerful tools for caregivers, and Alzheimer's caregiving classes in Spanish, and looks forward to renewing her certification in Drum Fit. She is also a certified mediator in the state of Texas. Her motto is that if one life has breathed easier because she has lived, then she has succeeded. This comes from her favorite poem by Ralph Waldo Emerson. Connie serves as the co-chair of the board of the Advisory Planning Council for the Area Agency on Aging. She has served over 10 years as a long-term care ombudsman, where she advocated for residents at local nursing homes and was instrumental in changing national legislation improving the lives of older adults in the United States. In 2008, she received the Volunteer of the Year Award for the Long-Term Care Ombudsman's Office for her policy work in Washington. Connie has also been recognized for her efforts and expertise on Alzheimer's disease, receiving the President's Volunteer Service Award by the U.S. Freedom Corps. Most recently, Connie was recognized by the Gustavia Pearls Women's Outreach Foundation and awarded with the President's Lifetime Achievement Award, signed by the President himself, President Biden, for her lifelong commitment to building a stronger nation through volunteer service. Connie says she does all of her work in honor of her grandmother, her namesake, who taught her Spanish beginning at age 25 and blessed her to be able to serve others in 2 languages. It is for all of these reasons that I have just read to you that I have asked Connie to share some words of motivation and encouragement with you today, because she shared with me, because I shared with her rather, that you all have talents and gifts that the world needs and is waiting for you. Introducing your commencement speaker, Mrs. Connie Asif.
Okay, can you see me? Hello, how are y'all doing? After all of that, reading all of that, it actually, it brings a lot of tears to my eyes, because all of my work is done because of my grandmother, my namesake. And I would give everything back just so I can have her here. So thank you so much. I really appreciate being here. I read a lot of the work that y'all have done, and I'm so excited because y'all are going to conquer the world. And I know y'all are, because each one of you has heart, a heart of service, a heart of commitment. It doesn't matter how long it took you to do this. And I promise you that every single one of you have something that the world needs. I congratulate each and every one of you. If you're a man, if you're a woman, if you speak more than one language, even if you don't, each and every one of us has something to contribute. I know that because many times I've been in rooms where my husband and I have been there, and I'm supposedly the subject matter expert, and I'm trying to tell something to someone and convey it, and they rather ignore me. And they look over at my husband, and I nod my head at him and wink. And he knows this spiel because he helped me take care of my grandmother, who had Alzheimer's and vascular dementia. And sometimes people in the room, they will listen to someone else, even though they may not be the subject matter expert. So I never want you to think, even if you know A to Z about a topic, I never want you to think, well, they didn't pick me to say it. They're not listening to me. It's okay if they listen to the other CHW or the instructor. Maybe they're not as articulate as you are. Maybe they don't know it as well as you, but you know what? They're listening. And that is the most important thing. We need to build trust. That is what we do as CHWs. I'm trying to speak to you to the camera. I do have prepared notes, and I really hate to look at notes, but I will do that. But I want to sincerely congratulate each and every one of you and all of your families, because without our families, our children, our husbands, our wives, our partners, our mentors, moms, dads, aunts, uncles, everyone, it brought us to this point today. I heard some of you say that you were not maybe in public health. I heard some of you say that this is a career change. In my opinion, COVID has taught us a lot of great lessons. It has taught us that we are all connected. What happens to me happens to you, happens to all of us. There is not one community, one language, one ethnicity, no one, because we're all human beings and we're susceptible to different diseases. In our own country, of course, heart disease is one of the things that kills many of us. Diabetes kills many of us. Chronic pain, people live with lupus, Parkinson's. The main thing that I want to leave with you, for you to understand, is that I am a community health worker, and that title to me is more important than any other title that I have. And I'm going to tell you why. Because I was in public health for 14 years. I worked for 2 local health authorities. They were the MD, MPHs that were here in Harris County that took care of the Katrina. We call them evacuees because they had to evacuate from their city and they had to come to the Astrodome. This was before the pandemic. No one ever thought something like that could happen. But I tell you this, when I walked around and talked to anybody, not during that time, but even during any other time, West Nile virus, chikungunya, you can name it, St. Louis encephalitis, and the different things that we have in public health, people would say, and what is it that you do? We have to be ready to give that elevator speech and tell people what we do. What I do is I help people age well, and I connect them to services that will help their lifespan equal their health span. Now, I don't know that I trademarked that necessarily, but what I mean by that is in our country, in the United States, I'm going to take these glasses off. In the United States, our health span, it could be as healthy as we are. Some of us are predisposed like I am. Both my parents have type 2 diabetes. They've had amputations. It runs in generations in my family. Obesity, heart disease, Parkinson's, Alzheimer's, depression, something that we don't talk about at all because it is looked at as a weakness. And we as community health workers are boots on the ground, and we are the ones that are out there bridging those gaps in our communities where we are. Each one of us has not only the opportunity, but people look to us when doctors are not around and the nurses are not around. We are there answering those difficult questions. Do we always know the answer? No, we don't. And we should never give an answer if we don't know it. But you better believe that I'm going to take their number down and their phone number and whatever that I need. And I will find out from the doctors, the nurses, the masters of public health, the epidemiologists, whoever it is that I know that I can send those lifelines to get the correct answer. We are the ones that are in the community that break those myths. I don't have to tell you about all the myths that are going around on the internet. I hear a lot of people say, Connie, I don't watch the news. It's too depressing. I can't look at that. And I think to myself, well, it's part of my job, because when I'm out in the community and somebody tells me, and believe me, I've heard it all, that if we take the vaccine that we're going to turn into a zombie because they saw it on Facebook, then I need to have some kind of an answer to give to that. I know that sounds a little bit ridiculous, but I also want to point them to trustworthy places. Now, in our local community, and I'm sure in your local communities, you may not realize, and you may, that there are such things called local health authorities, LHAs. In public health, we believe in a lot of acronyms, which is crazy. It's alphabet soup. But local health authorities are the ones that have the power to close schools. They're the ones that are the trusted members of our local city, county governments. Yes, CDC is national, and I'm not saying that we shouldn't listen to them, but we all know that on a national level, sometimes we have a lot of mixed messages. So that's why it's important for each one of us where we are in the city and the counties that we are, go Google it, look up local health authority for Tallahassee, Florida, New York, New York, Houston, Texas. You should find the city and the county local health authorities. They're most likely located in the health department. So I'm kind of on a soapbox here, and I know I'm lecturing to the choir, but I want to tell you all that I am so extremely proud of each one of you, because you have made the effort and the sacrifices despite all the load that you have, family, doctor's appointments, stress at home, stress at work, projects. People don't understand. My grandmother was my first mentor, and she said, you know, if you do that extra work, it's going to be very hard, and not everybody can do it. And not everybody is designed to be whoever they are. And what I mean by that is, I really don't have any attributes myself to be the president of the United States. That's not really one of my goals. But I do have a lot of other goals. And so what I'm saying to each one of you is find your passion. As a community health worker, you may not realize, but you have a passion. And if you haven't found it, look for it. You will find it. My passion is older adults, because my grandmother had Alzheimer's and vascular dementia, and people do not understand in our country what that means. I hear people say all the time, well, they're just have Alzheimer's, or it's just a normal part of aging. And that is not true. So that means we have a lot of work to do. Whatever you find your passion about, I know you had an instructor that worked a lot in South Texas, that worked a lot with children. If children and maternity and children's health and vaccinations are your passion, go for that, do it, because whatever your passion is what I can recommend for you to do. That could be lupus, that could be Parkinson's, doesn't have to be older adults. It could be anything in your own family. You're stronger when you're out in the community. I found that out myself by accident. I'm so passionate when I talk to people about diabetes and about eating the right diet and connecting the dots for them. All of us connect the dots, you know, and what I mean by that is when we were little and we had a little paper and we connected these dots on this little paper and we said, wow, that's a butterfly. That's what we do. We connect the dots for people in the community that don't have any idea that that class, diabetes class, is out there, and it's possible they could go to the food pantry and get free groceries every 2 weeks, or maybe they can get their low-cost insulin, or maybe they can even take cooking classes. We need to start building up our repertoire, even though we're not social workers. Believe me, a lot of the work I do is social work. I thought about getting a degree in that, but I thought, wow, that would take a long time. I think community health worker, again, you might not think it's so powerful, but I can tell you from experience, when I'm in a room and I tell people that I have a master's of business administration, and I tell them what I do, that I connect people to age well, so that they're not in the nursing home for 10 or 20 years. I want their lifespan to equal their health span, meaning I want them to be the healthiest as they can for as long as they can, with their dignity intact and their respect intact, all ages, all people, all races, because that's what we all want for our parents and for ourselves. And we're aging every day. That is my soapbox. But I want each one of you to look into what brings passion to you. It might be heart disease. It might be you had a grandmother, you have family members that have died of heart disease or diabetes or lupus or autoimmune disorders. It could be autism. It could be so many things. Find your passion and you will just be rewarded in ways that you cannot even imagine. I'm going to look away from the camera for just a moment. I want to congratulate you, and I just want to leave you with some nuggets because I don't want to take a lot of your time. I'm coming to my notes here, and I want to let you know the governor said that there are 4,000 community health workers in the state of Texas, and that we are nationally acknowledged, and that we need to show our value. I do believe in volunteering. I volunteered a lot of years for a lot of organizations. I have to say, very selfishly, because I was trying to learn everything I could about Alzheimer's, about nursing homes, about the regulations, because I was trying to take care of my grandmother. She was the only mom I had. And I wanted to be sure that she had the best care. And I had to learn all about Medicare, Medicaid, palliative care, things that I really didn't want to learn about at 25 years old. But what I also learned is that that became my passion, and I was really good at it. And I was surprised. And that is where this imposter syndrome comes in. Even now, I'm in a room with people, and I think they know what I think is common knowledge because I've been studying it, because I've been trying to take care of my loved one. Out of love is the reason why I came into this field. And so I'm sitting there and people are saying, well, I work with older adults. And I say, really? I said, well, do you know about the Area Agency on Aging? And they say, what? And I say, well, how about the Aging Disability Resource Center? And they say, no. And I say, well, may I please share that with you? Because those agencies helped me take care of my loved one, and I know they work. And so basically I'm sharing it with you. Even if you don't have a specialty with older adults, 60 years old and above, and caregivers, so that's everyone, doesn't matter what age. Area Agency on Aging is put in our United States back in the 1962, I believe it is, by the Older Americans Act. And you can Google it. You can Google Area Agency on Aging, New York, New York, Tallahassee, Florida, Houston, Texas. You will find nutrition, transportation. You will find all kinds of information, caregivers that may be able to come to the home. Does it cover everything? No. But I've had people come up to me at health fairs, and I'm talking to people about the Area Agency on Aging, and an older adult came up to me and said, young lady, they paid for my dentures. And I said, really? I said, I need you to tell these other people here because in our country, dentures, seeing and hearing is not one of the big things that we cover, even though Americans, you know, we pay a lot and we work a lot in our lives. Aging Disability Resource Center is another big connection, another big nugget I can share with you. An Aging Disability Resource Center, you get a bonus with that one because it's not just for aging, it's for disability at any age. So what I'm sharing with you in layman's terms is things that I share in the community because people, they really don't understand where to go. Now, am I saying that it covers immigrants and it covers all people? No, I'm not saying that, but we have to have a starting point and we have to start building that binder. There are places in our systems, we call them a hospital district, for instance, in Harris County, that does cover immigrants, because again, we are all connected. So these are different nuggets I want to share with you, but I also want to let you know that there are currently 57,500 community health workers, or what we call promotoras, or what we call promotores, which is like a male, a man. In the United States, the community health worker job market is expected to grow by 17.9% between 2016 and 2026. This is according to Career Explorer. Now, I can personally tell you that this may be underreported, especially because of COVID. Community health workers, again, we're boots on the ground. And we have to be there to bridge the gaps for people that really need us. They really need you. Some people will say, I'm not as articulate, or I don't speak that well as this other person. You don't have to be anyone else but yourself. When you roll up your sleeves and you do the work, it will not matter how well you speak or don't speak. What we say in Spanish is that we speak with our hearts in our hands, and people will get what you need and what you're offering them, and you will build those bridges of trust. The other thing that I do want to address, because I know I'm speaking a lot, is we want to break the cycle of the social determinants of health. Many people don't understand what that means. That means that where you live may determine how long you live. In Harris County, the third largest county in the United States, we can type in your zip code and we can tell you your life expectancy. That's kind of eyebrow raising to some people, but the reason why is because we know that people are living next to, maybe they're living next to chemical plants. Maybe there's a high rate of heart disease. Maybe there's a high rate of diabetes. Maybe there's a high rate of access to healthcare. What we say that maybe there's not enough grocery stores there in that area, and people are not getting what they need, nutritionally or otherwise, to be healthy. So that's where community health workers build the bridges, build the gaps, and we help people. Lastly, I don't want us to ignore biases. We all have them. But what I number one think that is so important is that we all need to break stereotypes. When people see us, no matter what we look like, no matter what color our eyes are, our hair is, what we look like, if our ideas, our solutions, we roll up our sleeves and we're doing the work, people will see that and they will respect that, and they will see the work, and they will no longer just see whatever this is in front of them. And that ultimately is our goal. When we're working with our communities, it is important to talk to them respectfully. A good example that I can tell you is that in Spanish, in English and Spanish, if I went up to someone, be very observant. There was a man that needed a COVID vaccine and he was looking all around. Nobody was paying attention to him. And I went up to him, and in English, we might say, "Sir, can I help you?" But in Spanish and in many Latin American countries, we say, "Hi, my name is Connie. I'm here to serve you and to serve God. What can I help you with, sir?" And immediately he looked at me and he said, "I would like to get a COVID vaccine, but I can't read. I can't write. And can you help me?" And I said, "Yes, sir, I can." And I made sure that he had that COVID vaccine that day. We have to be observant. We have to be welcoming to people. If we're at a health fair, wherever we're at, we have to smile. We have to wave at people. We have to say, come over. We have to be welcoming. We can't just be there. But I know I'm preaching to the choir because I know many of you, you have the heart of service and you have the heart to do this. This field is a field of pioneers, and that's what you all are. You're embarking on something that is at the ground level, and you are going to make all the difference. I feel it in my heart and I know it. And it doesn't matter how young, how old, or anything you are, every single one of you. Don't worry about that degree. If you could get it later, great. But my MBA really is not helping me with what I'm doing necessarily at this moment. It's my community health worker and my instructor and mentor that's most important. And I want to close with this. My boss asked me to give her a quote of my work and what I do in my job. And this is what I came up with. I am a Christian person, but I do respect all faiths and all people, because my motto is this: we advocate for all, or we advocate for none. There is no one that should ever be left out. Never. But this is what I love about my job. The authority by which the Christian leader leads is not power, but love. Not force, but example. Not coercion, but reasoned persuasion. Leaders have power, but power is safe only in the hands of those who humble themselves to serve. Each one of you, community health workers, community health worker instructors, certified by the states that you in Texas and the other states that you are in, you are all leaders. And I know that you lead with love, or you would have not even embarked on this program. I am a teacher, facilitator of Tai Chi. So I want to tell you, take a breath, take care of yourself. Sometimes you got to breathe in and you got to breathe out. And I want to show you something, and I hope you can see it. I'm sorry that I have to shift myself. I'm actually doing this on my knees because I couldn't get my lighting correct. Right hand above, it is your strength. That is the strength that each one of you have. In Tai Chi, that is our strength. This is my right hand. My left hand, 4 fingers together, 4 fingers together. It means friendship. And a bent thumb on the left hand, it means humility. So we have strength, strength in my right hand. 4 fingers on the left hand is friendship. Bent thumb is humility, strength, friendship, humility, and palm into fist is mutual respect from me to you. And a hearty congratulations to all of the future leaders. I'm so excited for all the wonderful things you are going to do in this world. You have done it, and you're to be congratulated.
Thank you so much, Connie. What a wonderful word. Thank you so much. I actually put some things that you said in the chat. I love that you said humble yourself to serve. What a wonderful message of servant leadership. Thank you all so much. And use your emojis in the chat or put some comments for Connie in the chat as well. Thank you again. I'm gonna remove that pin. So some of you have received your pin in the mail. Some of you have not. I remember the first graduation, we did a turning of the tassel. I wore my graduation cap and I wore my my graduation gown, but something about that just didn't feel like it fit. If you didn't know, you know, when you turn the tassel, it's a ceremonious gesture that really signifies that you're, you know, elevating to one area. And not to say that you all as CHWs and CHW instructors are not elevating from one level of learning, but for me, a community health worker is more than learning. It is a life experience. When I think of community health workers, I think of a superhero because this is someone that uses their powers, that uses their abilities to make the world a better place. And all of you, very akin to what some of the things that Connie just said, all of you are going to work now, or you have been working now to protect those around you, to protect the public, to fight for other people. Maybe you're not fighting crime, but you're fighting barriers to care, right? You're fighting poverty, you're fighting food insecurity, you're fighting those social drivers and those social determinants of health that really prevent people from being the healthiest they can be, or as like Connie said, from their achieving their full health span. And so this pin, if you have it, if you've got it, if it came in the mail, use this opportunity now to pin yourself. You see, I'm wearing mine here. And if not, wait till you get in the mail to pin it. But this is really just a remembrance, a reminder for you that you can do all things. You can really do everything. And there's somebody that is, you know, looking to you or influenced by you or encouraged by you. You are more than just a CHW. You are an agent of change. You are a life changer. You are a superhero. So congratulations to you. Before we close out our ceremony, I do offer an opportunity to let students, well, not students, sorry, faculty, family, or even friends say some words that they would like to about their graduates. So I'm going to just allow a few seconds. Let me put this view here so I can see. Is there anyone that would like to come off of mute at this time and just say a few words to your to the graduates or to your students or your family members?
I don't know what I'm doing, Charles.
Oh.
Let me put you on mute, Connie. Thank you, Charles, for the technical assistance, by the way.
Hi, Quisha. This is Grace.
Hi, Grace. Go ahead.
Hi. I just wanted to say congratulations to everyone. Thank you so much for being an amazing instructor and taking such good care of Karina and encouraging her. I wish you all the best and excited for Karina and everyone else's future. Such important work.
Thank you so much, Grace. And that's Karina's mom. Thank you so much. We were glad to have her.
Yes.
Yeah. Roxana, floor is yours.
Good morning, everyone. I'd like to just say congratulations to my best friend, Amanda Romero, but to all of the CHWs and CHW instructors, congratulations. I too am a CHW and I sit as the vice president of TAPSHWA. And so I just wanted to congratulate all of you guys and just remind you to plug into your local associations and make sure that you continue to build a network of like-minded individuals. And we're here for you as a state if you ever need anything or have questions. So congratulations to all. And thank you, Quisha, for this great graduation.
Thank you, Roxana. And I actually just mentioned to them, my students on Thursday, about your conference. Amanda shaking her head. And I just said, so who's ready to submit their proposal? So you'll get my proposal to speak as well, but hopefully you'll get one from one of my students also. So thank you so much for attending
Great.
and supporting Amanda. Marlon, the floor is yours.
Thank you. Again, I wanted to congratulate everyone. Each and everyone has come a long way. As a CHW instructor, I know that, you know, it can get tough at times, right? But what I do want you to remember is, of course, to take care of yourself, right? If we cannot take care of ourselves, we cannot take care of others, right? We are that link in the community, creating that trust, right? But just remember, like Connie was also saying, stay humble, stay connected with each other. I do encourage each and every one of you to stay connected with each other. You know, start your network here with those that you're beginning this journey with. I also want you to remember that us at the Umemba Health Academy family, we're always here for you. We're always cheering for you. And we can't wait to see what the future holds for you in this profession. So thank you for choosing us to follow you and to see your growth. And we're cheering for you.
And I couldn't have said it any better. Thank you so much, Marlon. I'm gonna put this music on now. Congratulations, everyone. Go out, make your mark on the world. You deserve all that comes to you. You did a great job. Thanks for spending your time with us. I've got my little confetti here. Thank you so much. I love all of you. Have a great weekend. Go celebrate with your family. And you know, I'm just an email away if you ever need anything. Thank y'all so much. Congratulations. You all did amazing. Take care.